Now, how to sift accurate information from misinformation is becoming one of the challenges of this crisis, isn't it? And here's one example. We looked at Google Trends earlier. One of the top searches was ibuprofen, and that's connected to a statement from 2 days back where the French Health Ministry suggested that that anti-inflammatory painkiller could worsen the effects of the coronavirus. The story has been very heavily shared. So in the UK has this WhatsApp message which says, from an NHS colleague, we've just been sent a medical alert that no one is to use anti-inflammatories. So is this true? Well, we contacted Kalpana Sabapati, a doctor at the London School of Hygiene and Tropical Medicine, to help us.
Certainly, in the first instance, paracetamol is recommended anyway to reduce the temperature or for aches and pains, headaches, that sort of thing. I don't think the evidence actually is strong enough for us to start saying that ibuprofen should never be used. But certainly, I think erring on the side of caution in the context of COVID and so many unknowns, then certainly it would be safer to stick to paracetamol as the first line.
And does that caution also apply to other anti-inflammatories?
Potentially, yes. But like I said, there is actually no established evidence that there is a problem with ibuprofen and COVID-19, or even really with respiratory infections. There have been studies that suggest that may be the case, but it's not established by any means.
Here's something else we've seen lots of messages about, suggesting that eating garlic helps protect you from this virus. Is it true? Well, you won't be entirely surprised to know the World Health Organization has responded to this, saying garlic does have antimicrobial properties, but there's no evidence that eating it will protect anyone from this coronavirus. I repeat, no evidence whatsoever. Next is the issue of alcohol as a disinfectant. Lots of you will use gel and sanitizers, and they must have a certain alcohol content to work. In fact, to be effective, they need to contain at least 60% alcohol. And of course, every bottle of alcohol you can buy in the shops to drink doesn't get close to 60%. Now, some people have been sharing information suggesting putting alcohol bought to drink all over your body can kill the coronavirus. Is that true? Well, the answer is no. Again, the World Health Organization says it will have no impact on the virus, particularly a virus that's entered your body. It adds that actually putting alcohol over your body can be harmful to your eyes and to your mouth. The next one is face masks. There are huge social pressures in some countries to buy these and wear them. Here are some experts on what that will achieve.
You're in an environment where everybody else is wearing a face mask and you're not, then it may make you feel vulnerable because you feel like you don't have the protection everyone else does. But logically, if you're not close to people, they're not coughing and sneezing on you, then a face mask isn't necessary. One of the problems, if lots of people who don't need face masks are using face masks or stockpiling them, it means that there aren't enough face masks available where they're really needed for people like healthcare workers who are on the front line and dealing with suspect or confirmed coronavirus cases.
Now, the big tech companies, Facebook, Twitter, Google, are saying they're doing everything they can to curb misinformation on their platforms. But to be clear, the simplest thing to do if you want to be sure about that this information is good is go to the NHS website, also go to the World Health Organization website, and there's also a huge amount of information on the BBC News website as well. And I guess there's one bit of advice that everyone is agreeing on, which is wash your hands for at least 20 seconds, a number of times per day.